Hey guys, welcome to another video. Today our topic is on autism. We'll be talking about the causes of autism, symptoms, treatment, and finally diagnosis. So let's get started. So what is autism? Autism or autism spectrum disorder is a neurodevelopmental disorder that affects an individual's ability to communicate, socialize, and behave in a typical way. Autism is a spectrum disorder, which means that it affects individuals in different ways and to varying degrees of severity. Some common symptoms of autism include difficulty with social interaction. Individuals with autism may struggle to understand social cues and norms. They have difficulty in making eye contact and may prefer to be alone. Second is repetitive behaviors. Individuals with autism may engage in repetitive behaviors such as hand flapping, rocking, or repeating words or phrases. Fourth is difficulty with communication. Individuals with autism may have difficulty with verbal and nonverbal communication, such as difficulty understanding sarcasm or irony, or difficulty using gestures or facial expressions to convey meaning. It is important to note that the symptoms of autism can vary widely among individuals, and not all individuals with autism will exhibit all of these symptoms. Additionally, symptoms may present differently depending on an individual's age, gender, and level of functioning. The exact causes of autism are not yet fully understood, but it is believed to be a complex interplay between genetic and environmental factors. Research has shown that there is a strong genetic component to autism. Studies have identified several genes that are associated with an increased risk of developing autism, and it is believed that multiple genes may be involved. However, it is important to note that all individuals with autism have a known genetic cause. Second is environmental factors. Various environmental factors have been linked to an increased risk of autism, such as prenatal exposure to certain chemicals and infections during pregnancy. However, it is important to note that these environmental factors are not necessarily the direct cause of autism, but rather may contribute to the development of the disorder in individuals who are already genetically predisposed to it. Third is brain development. Research has shown that abnormalities in brain development may be a contributing factor to the development of autism. Studies have identified differences in the structure and functioning of the brains of individuals with autism compared to typically developing individuals, particularly in areas of the brain that are involved in social interaction and communication. It is important to note that while these factors have been linked to an increased risk of autism, they do not necessarily cause the disorder on their own. The exact cause of autism is likely to be a complex interplay of genetic and environmental factors, and further research is needed to fully understand the underlying mechanisms. As I mentioned earlier, autism is a spectrum disorder, which means that it affects individuals in different ways and to varying degrees of severity. Here are some common symptoms. First is difficulty with social interaction. Individuals with autism may struggle to understand social cues and norms and have difficulty making eye contact and may prefer to be alone. Second is repetitive behaviors. Individuals with autism may engage in repetitive behaviors such as hand flapping, rocking, or repeating words or phrases. Third is sensitivity to sensory stimuli. Individuals with autism may be hypersensitive or hyposensitive to sensory stimuli such as loud noises, bright lights, or certain textures. Fourth is difficulty with communication. Individuals with autism may have difficulty with verbal and nonverbal communication, such as difficulty in understanding sarcasm or irony, or difficulty using gestures or facial expressions to convey meaning. Fifth is restricted interests. Individuals with autism may have intense interests in specific topics or activities and may struggle with changes in routine or unexpected events. Six is unusual responses to social situations. Individuals with autism may have difficulty making friends or maintaining relationships and may struggle with understanding or expressing emotions. It is important to note that the symptoms of autism can vary widely among individuals, and not all individuals with autism will exhibit all of these symptoms. Additionally, symptoms may present differently depending on an individual's age, gender, and level of functioning. If you suspect that you or someone you know may have autism, it is important to seek a professional evaluation for a proper diagnosis. So, the process of diagnosing autism spectrum disorder typically involves a comprehensive evaluation by a team of healthcare professionals, including a pediatrician, psychologist, and psychiatrist. Here are some common steps involved in the diagnosis of autism. First is developmental screening. The first step in the diagnosis of autism is typically a developmental screening, which may be conducted by a healthcare professional or completed by the parent or caregiver using a standardized screening tool. This screening is used to identify any potential developmental delays or concerns, including those related to social communication and behavior. Second is diagnostic evaluation. If the developmental screening suggests that autism may be a possibility, a diagnostic evaluation is typically conducted. This evaluation involves a more in-depth assessment of the individual's development, including their social communication skills, behavior, and cognitive functioning. This evaluation may be conducted by a team of healthcare professionals such as a psychologist, psychiatrist, or a developmental pediatrician. Third is diagnostic criteria. The diagnostic criteria for autism are outlined in the Diagnostic and Statistical Manual of Mental Disorder. To receive a diagnosis of autism, an individual must meet the criteria outlined in the DSM-5, which include persistent deficits in social communication and social interaction, as well as restricted and repetitive patterns of behavior, interests, or activities. It is important to note that the process of diagnosing autism can be complex and may involve multiple healthcare professionals. If you suspect someone that may have autism, it is important to seek a professional evaluation for a proper diagnosis. Early diagnosis and intervention can make a significant difference in the long-term outcomes for individuals with autism. As of today, there is no cure for autism, but there are various approaches to treating the symptoms of autism. Treatment for autism typically involves a multidisciplinary approach that addresses the individual's unique needs and challenges. First is behavioral therapy. Behavioral therapy, such as applied behavior analysis, can be an effective treatment for individuals with autism. This treatment focuses on teaching new skills and reinforcing positive behaviors while reducing problem behaviors. This type of therapy can be tailored to the individual's needs and can be provided in a variety of settings, such as home, school, or clinic. Second is medication. Medications can be used to treat specific symptoms of autism, such as anxiety, depression, or aggression. However, medication is typically used in conjunction with other therapies and should be closely monitored by a healthcare professional. Third is educational interventions. Educational interventions such as special education services and individualized education plans can be effective in helping individuals with autism succeed in school. These interventions often involve a team of professionals, including teachers, therapists, and psychologists, who work together to develop a plan that meets the individual's unique needs. Fourth is speech therapy. Speech therapy can be effective in helping individuals with autism improve their communication skills, such as language development, conversational skills, and social communication. Fifth is occupational therapy. Occupational therapy can help individuals with autism improve their motor skills, sensory processing, and daily living skills. It is important to note that treatment for autism should be individualized and tailored to the individual's unique needs and challenges. A combination of therapies and interventions can be necessary to achieve the best outcomes for the individual with autism.